As a spine surgeon, I see patients all the time who've looked at their MRI report and are very confused on what that means. Well, I'm going to go over a couple cervical spine details here to show you what you should be looking for if you're going to try to look at your own images and some of the terms we use when talking about a cervical MRI. Okay, so assuming you can get up to this page here where you can pull up the different images, the first thing you want to do is click on Layout, find a way that there's a layout, and then the best thing to do is click on this where it's a 1x2 box. Then you have these boxes side by side. That's a great first way to do it. First, find a layout, and all of them are going to look different, and it's a 1x2, so that way you have two screens, and you can kind of look at it as a side view and a down the tunnel view. Then on the side, the key thing we look at is the sagittal view. T2 will be the best. You just click and you can drag it over. Now I put the numberings on this level, and then on the axial, you want to find that. So go back over to the side here and find the axial. Usually the best ones is axial, T2, and then the merge I think is the best quality. You can grab that and drop that over here. Then different arrows, then different clicks of the mouse can have you zoom in and zoom out to get it kind of nice and centered. Okay, so once you have these two images up, which I agree is really half the battle, here's how you interpret it. It goes bone, disc, all the way down. These blocks here are the bones, the black things are the disc. If I zoom out, you can kind of see where it's looking. Here's the brain, here's the mouth, here's the back of the neck, and then here would be like a view if I have a ladder. I'm standing behind the patient, I'm looking down the back. So it'd be kind of like this. This is the side view, looking at the spine just like this. And then here is if we were looking down the tunnel. So looking down the tunnel of the spine is what this view is. Another key thing to point out is this is going to be the left side of the patient. This is the right side of the patient. Left side, right side. So if you're going level by level, and again I already put the levels on here, you usually start up at C2, C3, and C2 is going to be this bone, it almost looks like a finger, whereas all the other bones are rectangle. And at the disc spaces is where you have the spinal cord. The white circle around it is the cushioning, and you have these little tunnels that come out on either side. So C2, C3 is usually wide open. Here's a nerve tunnel, spinal cord, the white fluid around it. Spinal cord, white fluid around the spinal cord. As we go down the cervical spine, here's another level. Cervical 3, cervical 4. Going down a little further, here's cervical 4, cervical 5, still open nerve tunnels. That's what we can use for comparison. As we go down a little further, this patient in particular has a unique pathology, and that's why I wanted to share it, is that this is a 2-level disc herniation. Here's C5, 6, and you can see that spinal cord that was nice and open, it was a nice and open area with all this fluid around it. It's now going to have this outpouching of this disc material. You can see right here coming out and squeezing both the spinal cord, and then just as I told you, this is the left side, it's squeezing the nerve tunnel on the left side, and this is the C6 nerve. So at C5, C6 is where the C6 nerve comes out. That kind of goes down the arm, usually to these two digits here, but there's a lot of overlap, especially with C6 and C7. If it was C4, C5, that hit the C5 nerve. The C5 nerve goes to the shoulder. So right here is the C6 nerve, and to put it into kind of a pictorial representation, so you're C2, 3, 4, 5, 6, that'd be this nerve, but this nerve right here on the other side is what's getting pinched. So it's a disc herniation coming out, hitting this nerve right here. So if we scroll down further, it's going to open up again. Well, there's that big disc material. So it opens up again, and going down to the next level at C6, C7, here's the disc material, this black stuff, and boom, there's this next level. So it's C6, C7 on this. Again, looking down, here's the spinal cord, white fluid around it, spinal cord, white fluid. Here's the nerve tunnel here, getting totally compressed. And if we go down to the next level, it's going to be nice and wide open. Oh, look at that, nice and wide open. Here's a nerve tunnel on the left side, nerve tunnel on the right side. Here's the C6, C7, so it hits the C7 nerve, and that's where you get foraminal stenosis. And the foramen are these nerve tunnels. So if I go back up to a good level to show you, so here's a foramen coming out for a nerve, foramen coming out for a nerve. There's the spinal cord, the white fluid around it. When you get squeezing of that spinal cord, that's what causes the condition of cervical myelopathy. or it can lead to cervical myelopathy is probably the better way to say it. That's when you have symptoms from spinal cord compression. When these nerves get pinched, that's what can cause radiculopathy, the nerves getting pinched. That can cause numbness or tingling going down the arm, going down, if it's in the back, it can go down the leg, it can go into the hand. Again, this is the cervical spine, there's the brain, there's the mouth, and that's a good way to think about it. Okay, hopefully that gives you a good primer of how to pull up your images and what to be looking for. I think it's great to start with the spine surgeon in terms of getting care. The spine surgeon can then direct you either to physical therapist, pain management, chiropractic doctors, or even possibly, as a last resort, surgical management. For this pathology here, I have other videos that I've already put up on different platforms that show that this patient failed conservative management, had a 2-level cervical disc replacement. Not everyone's a good candidate for a disc replacement. You need to look at the disc height, the stability, and if they failed non-surgical treatment options, which this patient met all those. She's more than 1 year out from surgery and she's doing fantastic.